I think my whole life I've been a yes type person, but you have to say no at certain times. I think being a specialist plastic surgeon, it's very important to have high ethics and standards and to be honest and open with your patients and what you can achieve and what you can't achieve. But some of the examples that I would use for when I would say no is obviously we do screen our patients and we're having a discussion with them if there's any concern about psychological disorders such as body dysmorphic syndrome or high levels of anxiety or other psychological problems. And if those issues haven't been addressed or been reviewed, then it's important to take a step back, say no to the procedure that the patient is so keen to have, and it would still help, but it's not necessarily the right thing because the expectations, the outcomes that they have won't necessarily match up with what you deliver. So in those kind of instances, it's important to say no and support that person by giving them options or referring them back to their own GP or to a psychiatrist for assessment. So that's one example. I think another example is I'm very interested in body contouring type procedures, which are big type surgeries, and they do take a bit of aftercare, both in the hospital and afterwards. And to do those types of procedures, which are elective, they're not required, a lot of them, but they are very beneficial for patients. You don't want to do them in people who have significant comorbidities like bad heart disease, chest, big problems that would be complicated from the surgery. So you still got to do what's safe. And I think, when you see a surgeon, our primary goal is to first do no harm. It's to look after our patients. It's to make sure that we try and do the right thing, engage them in that conversation, learn about them, learn about the whole level of their past medical history so that we can approach it in the right manner and in a safe manner. And thirdly, I guess the group that I don't operate on are the people that I just don't have a connection with. And I know that sounds a little bit strange, and it doesn't happen very often. So I hope I'm quite personable. I hope I'm quite approachable and empathetic to them. But there are people that we just don't click. And I think it's a bad mix trying to do such life-changing surgeries when you're looking after them, putting your heart and soul into their care, if they don't necessarily are on the same wavelength. And maybe that's where you get a disengagement, or maybe you get a barrier between the expectations of the patients and what you can deliver. So if the patient doesn't feel comfortable and I don't feel comfortable, I think sometimes it's worthwhile bringing that up and suggesting that they move forward with a different surgeon. And I think that's a sensible way of approaching it. Doesn't happen often, but it can happen.